Growth and development are not same. So what is growth and what is development? Let's see the definition. So growth is a process of physical maturation resulting in increase in size of the body and various organs. So it's a physical maturation, okay, and it occurs mainly by multiplication of the cells and an increase in intracellular substance. So yes, there is increased size of the tissue, and you all know, you have already read your pathology, is tissue can grow by either increase in size or increase in number of the cells. Dear student, please remember that it is multiplication of cells, that is hyperplasia, that is most important in case of growth. Hypertrophy also has a role, but main role is hyperplasia, that is multiplication of cell, and it is a quantitative changes of the body. On the contrary, development is a process of functional and physiological maturation of the individual. So the before was physical maturation, but now this is the physiological maturation, and it is progressive increase in skill and capacity to function. It is mainly due to maturation and myelination of the nervous system, and it includes psychological, emotional and social changes. It is a qualitative aspect. Is it clear what is growth and what is development? So what are the difference? Growth is increase in size, I have explained, and development is achievement of function and skill. Growth is an external phenomenon, whereas development is an internal phenomenon. Growth is a quantitative aspect, development is a qualitative aspect. Growth can be measured directly, which will be discussed in later in today's class, and there is no direct measurement of development. There are some tools that will be discussed in the later class. Growth stops after reaching a certain maturity, okay, and development is a continuous process. So these are the important difference between growth and the development. Next point of discussion is what is the pattern of growth in infant, children and adolescents. So there are some unique features of growth and development, and we will discuss these topics under this following heading, that is rate of growth varies in different periods. Growth pattern of every individual is unique. How unique? We will discuss later. And different tissues growth at different rates. The growth rate is not same for all the tissues. Different tissue grow at different rates. So first was point, the unique feature of growth is rate of growth varies in different periods of life. The growth is not uniform throughout the whole period of life. Sometimes the growth is accelerating, sometimes it's steady, sometimes it is decelerating. If you look at the graph, this graph, you can see that the graph is not uniform throughout the life. Look carefully that when the graph starts, it's a normal growth velocity curves, okay. The left one is for girls and the right one is for boys, and the x-axis denotes the age, y-axis the growth velocity. The growth curve shows that in the first part of the life, it is at the peak, high level, okay, both girls and boys. Then it is the curve goes downwards, the decelerating, and again the curve is go upwards at the when the girls or boys they reaches their puberty. So the purpose of showing this growth curve is to make you understand that growth is not uniform or linear, same fashion throughout our life. Sometimes it's accelerating, sometimes it's steady, sometimes it goes upwards. And from this curve, I will make you another point. Look very carefully that left side curve, that is for girls, the growth spurt, that is the growth spurt is earlier, 9 to 10 years, okay, and for boys it is slightly later, 11 to 12 years. So growth spurt occurs earlier in case of girls, but their final height is low, but in case of boys growth spurt starts later but final height is more than the girls. So I have already told you that growth is not uniform or not same throughout the life. There are certain periods of life when there is growth rate is high, where sometimes it is slow, sometimes it is steady. Okay. So according to this concept, there are certain terminologies or terms which you have to remember very carefully. These are the terms, that is, first 2 weeks of life is termed as ovum, 3 to 8 weeks is known as embryo, and 9 weeks till birth is known as fetus, and 22nd weeks to 7 days after birth is known as the perinatal period. These are the intrauterine period, and after birth, first 4 weeks after birth is known as newborn, then birth to less than 12 months is known as infant, 1 to 3 years is known as toddler, 3 to 6 years is known as preschool, and 6 to 12 years is known as school going age. What is adolescence? 10 to 19 years. Adolescence is again divided in 3 parts: early, mid and late. What is early? 10 to 13 years is early adolescence, 14 to 16 years is known as mid adolescence, and 17 to 19 years is known as late adolescence. So please look at the slide. I am giving a few seconds to please keep in your mind. There are lots of questions from this slide. Okay, what is ovum, what is embryo, what is fetus, what is newborn period? Okay, should I progress? So tell me, what is newborn? What is newborn? What is newborn? Stand up. What is newborn? I have given enough time in the previous slide. Just I have discussed it. What is newborn period? What is newborn? Huh? Speak loudly. First 4 weeks of life after birth. Okay, very good. Sit down. What is infant? Stand up. Before 12 months. From? Starting from birth. From 4 weeks till 12 months. Okay. And what is toddler? Stand up. What is toddler? 1 to 3 years. Very good. Next, what is preschool? 3 to 6 years. And what is school going age? 6 to 12 years. Okay, very good, very good. Okay. So another unique feature of growth is this cephalocaudal and proximodistal. Cephalocaudal. What do you mean by cephalocaudal? Cephalocaudal means from head to toe. So growth starts from the head and it goes downwards to toe. If we compare between head and neck, which will grow fast? Cephalocaudal, I have already explained, from head to toe. So upwards to downwards. If we compare brain and or head or neck, which one will grow fast? It's head or it's neck? Head. Head to toe. So which one will come fast? That will grow more. Okay. So it's cephalocaudal means head will grow faster than the neck. And if we compare between arms and legs, is it arm or leg? Which one will grow fast? It's arm. Okay. And which how proximodistal means centered to outwards. So if we compare between the hands and the fingers, the child which learns to use his hands before the finger. So it's from center of our body to outwards of the body. Okay. So head to toe and center to outwards. These two are the very unique feature, cephalocaudal and proximodistal. Okay. And the last important feature of growth is rate of growth is not same in all the tissues. Okay. Growth rate is different in different tissues. Let's discuss one by one. First, look at the graph of head growth of brain growth. My dear student, please remember, when the baby is born, the head size is approximately 65 to 70% of an adult. Okay, then the brain grows rapidly. Within the first 2 years, the brain growth is completed by almost 80%, and by end of 5 years, it is almost 90 to 95%. So you can easily understand how much the first 2 or 5 years of life is important for the development of brain. It is one clinical aspect also, because most of the parents, particularly the mothers, they are more worried about the growth of their children. সবাই তো বাচ্চারা একটু গুলুমুলু বাচ্চা পছন্দ করে। তো we the pediatricians should make them understand that growth, your body, the growth of the body is not solely important. The brain of your baby growth and development of brain of your baby is also important. This period is only 2 years. Okay, within 2 years, the brain growth is completed by almost 80%. So, in this period, what are the necessary steps you have to take for the proper development of the brain, like continuing exclusive breastfeeding for the first 6 months and starting weaning foods, etc. Okay. Then come to the somatic growth. Somatic growth means skeletal growth. I have already told you that growth is very rapid during the early periods of life, then it goes slowly down, then steady, and again it's as a growth spurt when they reaches at the puberty. Rapid during the first early childhood, then is steady, then again it go upwards when they reaches at the puberty. Okay. Lymphoid growth. This one, lymphoid growth. Lymphoid growth is maximum during the mid childhood, that is 4 to 8 years of life. Okay. 4 to 8 years of life. It has one clinical implications also. Sometimes the mothers come with their baby to show us some lymph nodes and say, ডাক্তারবাবু দেখুন তো এগুলো কি হয়েছে, মাথার পিছনের দিকে যে গুলিগুলি, এগুলো টিউমার নয় তো, এগুলো টিউমার নয় তো, মাথার পিছনে আছে, এখানে আছে, এখানে আছে। তো why we should know this? Because we should know that this age group 4 to 8 years, mid childhood, this is the period where the lymphoid growth is normal. Okay, overgrowth. So we should make them understand that these lymph nodes are lymph nodes, not tumors. These are quite natural at this age. But side by side, we have to make them counsel that if the size increases rapidly or there is any other associated symptoms, we have to work up them and we have to advise them to come back. Okay. পাবে তোমরা যখন ওয়ার্ডে থাকবে, দেখবে মাঝে মাঝে মাদাররা আসে যারা বলবে যে এখানে বেবির এখানে কানের পিছনে দেখুন একটা বড় কি হয়ে আছে, টিউমার হয়েছে কিনা দেখুন। সেটা ওর কিন্তু টিউমার নয়। 4 to 8 years এর মধ্যে কিন্তু বাচ্চাদের লিম্ফ নোডসের একটা ওভারগ্রোথ হয়, ইভেন টনসিলস। এই সময় বাচ্চাদের লিম্ফয়েড যে টিস্যু আছে সেগুলো ওভারগ্রোথ হয়, দ্যাট ইজ কোয়াইট নর্মাল। বাট ইউ হ্যাভ টু কাউন্সিল দ্য প্যারেন্টস ইফ দ্য সাইজ ইজ ইনক্রিজেস মোর র্যাপিডলি, particularly if it is clinically significant, that is more than 10 centimeter, or there are associated symptoms, then they should come back and we will have to investigate whether it is pathological or not. Okay. Coming to the last graph, that is gonadal growth. You can easily understand that this curve is quite different from the rest of the three. The curve is almost close to the x-axis, that is till 10 to 11 years the gonadal growth is dormant, and when the puberty comes, due to the effect of certain hormones that will be discussed later, that is androgen or estrogen, due to the effect of this hormone there is a rapid growth come. Okay. So gonadal growth is dormant during the early life of life. When they reaches puberty, it is a significant spike. So these three are the unique feature that is known as the patterns of growth. First point was what was the first point? That growth is not uniform throughout the life. There are certain periods of life when the growth is accelerating, sometimes it is steady, sometimes it is decelerating. And second point was growth of every individual is unique in what? Unique in two main points, that is cephalocaudal and proximodistal. And third one is growth of the different tissues is not same, growth rate of different tissue is different. Okay. The next topic of discussion is what are the factors affecting normal growth and development. My dear student, I have already told you that growth and development are not same, but they are discussed very often, they are discussed together. So there are certain factors which affect growth can also affect development. So the factors which affect growth will also affect the development. What are the factors? We will discuss this factor under the following three headings, that is fetal factor, postnatal factor and social factor. What are the social fetal factor? Fetal growth, what is fetus? What is fetus? Fetus? What is fetus? 3 to 6 weeks. What is ovum? 0 to 2 weeks. 3 to 8 weeks, embryo. 3 to 8 weeks embryo, and 9 weeks to birth is fetus. Okay. So fetal growth is influenced by fetus itself, the placenta, and some maternal factors. A fetus grow, good morning sir, a fetal will grow into a normally healthy baby under normal circumstances. The mother, the fetus and the placenta, they all act as a unit to provide the proper growth of the fetus. Okay. The most important fetal factor is genetic potential. So fetal growth is mainly controlled by the genetic potential of the fetus. Tall mother will have the taller babies. There is a strong correlation between the maternal height weight and the birth weight of the baby. The so-called maternal constraints prevents the overgrowth of the fetus, thus prevents dystocia and conserve the mother's ability to have future pregnancies. Okay. Next important factor is gender. We all know that boys have generally taller and heavier than the girls at birth. And hormonal factor and hormone and growth factor. There are several hormones which controls the fetal growth, and one of the most important hormone is insulin, IGF-1, IGF-2. Okay, the insulin is secreted from the fetal pancreas, and IGF-1 and 2 are secreted from the placenta. So it also has a clinical implication. Then whenever we deal with a IDM baby, that is infant of a diabetic mother, the fetus is in hyperinsulinemic state, that the insulin level of the fetus is high, and that insulin causes overgrowth of the fetus. So whenever we get an IDM baby, there is very chance of getting a large for gestational age baby. Okay. Next important hormone is thyroxine. The fetus starts its level production of thyroxine at the age of 12 weeks, but the level is so low that fetus is fully dependent on the maternal thyroid hormone for its development, particularly the neurodevelopment. And third important hormone is glucocorticoids. Glucocorticoid is mainly responsible for the maturation of the certain organs, particularly towards the end of the gestation. What are the organs? Lungs, liver, gastrointestinal tract, you all know this. So if a fetus is, if a baby is born prematurely, the lungs are not mature due to the lack of these glucocorticoid hormones, and we may get a baby with respiratory distress, that is known as respiratory distress syndrome. Okay. And another last hormone is growth hormone. But please remember, though growth hormone is quite, the level is so high, but it has least important role in development of the intrauterine life. Okay. So most important hormone which controls the intrauterine growth is insulin. And next factor is placental factor. Placental factors, we all know that there is a strong correlation between the birth weight of the fetus and the weight of placental tongue. As the pregnancy increases, the placenta also increases in size to supply nutrients from the mother to the fetus. Significant structural and functional changes make this adaptation more efficient. On what are the structural and functional changes? The total surface area of the villus increases, the fetal capillaries dilates, and feto-placental vascular resistance decreases. All this positive remodeling causes supply of the nutrition from the mother to the fetus, ultimately helps in growth of the fetus. A maternal factor, maternal height, weight, not only during this pregnancy but also his own height and weight during his childhood, his nutrient intake during this pregnancy and conception, all these factors regulates the growth of the fetus. Okay. Teenage, early pregnancy, high parity, anemia, maternal use of tobacco, alcohol or any drug, maternal obstetrical complications like multiple pregnancy, pregnancy-induced hypertension. These are some factors that negatively impact the growth of the fetus. And some systemic disorder like chronic kidney disease, congestive cardiac failure, and intrauterine infection, acquired infection like torch infection, toxoplasma, rubella, cytomegalovirus infection, herpes simplex, syphilis, varicella, etc. These causes some growth retardation. Okay. Next, come to the postnatal factor. Here also the most important factor first comes with genetic factor. Certain genetic disorder, like you all know, that Down syndrome, Turner syndrome, or single gene disorder like Prader-Willi or Nandan syndrome, this causes short stature. Though most of the genetic disorder causes short stature, there are some genetic disorder which causes tall stature. Remember this, Klinefelter syndrome and Sotos syndrome. Then come to the IUGR. If the baby is IUGR, it results in low birth weight of the baby, and most of the baby develop their catch-up growth within 2 years of life, but not all. Almost 10% they remain short. Hormonal influence. I have told you that most important hormone which controls the intrauterine growth was insulin, but this time after birth it is mainly the growth hormone and thyroxine that causes their linear growth. Gender. I have already shown you a slide where the growth spurt was earlier in case of girls. This early growth spurt and shorter duration, they causes a significant difference of 13 centimeter from the boys. Boys, the growth spurt occur later, but ultimately final height is more than the boys, 13 centimeter. And nutrition. So it is needless to say nutrition. You have done several classes of nutrition. If the child is suffering from protein energy malnutrition, there is deficiency of certain vitamins like vitamin D, vitamin C, and micronutrients like iron, calcium, zinc, iodine, the child will suffer from the growth faltering. Okay. And infection. Several infections like recurrent respiratory tract infection, recurrent diarrhea, systemic infection, parasitic infection, they causes some negative impact on the growth. Okay. That is one important data, that if there is recurrent diarrhea before the age of 2 years, the child will suffer from stunting. The attributable risk of stunting for 5 or more bouts of diarrhea before 12 months of age is as high as 25%. Trauma. If there is a damage to the growing bone, the epiphysis will be damaged, that will hamper the final height. And social factors, if the child comes from a higher socioeconomic class, they will have a better hygiene and better nutrition, which will promote their good health. Says if the country's GDP and per capita income is better, that will promotes the better health of the child. Climate, climate has an impact on the growth. It has been seen that the growth rate is more in spring season, whereas it is low in summer. Why? Because in summer there is more chance of infection, and in case of winter the chance of infection is low. That is probably the reason behind variation of growth in climate. And in emotional factors, the children who comes from broken family or orphanages, they suffer from the growth retardation. Anxiety, insecurity, lack of emotional support, these are the some factors that hinders their growth. Cultural factor, there are so many cultures in our society, like starting some animal milk formula, not continuing the breast milk till 6 months of age, exclusive breastfeeding, not starting proper weaning foods. These are the some factors that ultimately results in their final growth. Okay, parental education, children, the mothers whose children are more educated are likely to adopt the more health promoting behavior, and ultimately that will influence the growth of the child. So already discussed in details about the factors which control growth and development. It was discussed in 3 headings, that is fetal factor, postnatal factor and social factor. Next, coming to the last part of our discussion, that is methods of assessment of growth and several growth parameters used for assessment of physical growth in infants, children and adolescents. So why it is important? The answer is here. Normal growth is the indicator of adequate nourishment. Deviation from normal pattern is indicative of a pathological process. And periodic assessment facilitates early detection of growth faltering, which may be the first manifestation of an infection or a disease. And this ensures early management and optimum outcome. What are the growth parameters? You all know, all of you have done the clinical classes. These were discussed several times. That is weight, length or height, head circumference, chest circumference, mid-arm circumference, body mass index, body proportion and skin fold thickness. So let's discuss these parameters one by one. First one is growth, weight. Weight is the single most important parameter for monitoring growth, but one single measurement is not enough. Serial monitoring should be done. How frequently the growth should be recorded? For the first 4 weeks, it should be measured weekly. From 1 to 3 months, it should be measured monthly. 3 months to 5 years, it should be measured 3 monthly, and these measurements should be plotted on a standard growth curve. For the steps of weighing newborn or an infant, the scale should lie on a flat, hard, even surface. It should not be on a soft surface. That will not give you the exact result. We should explain all the procedure to the parent or caregiver. Infant should be weighted unclothed or minimum clothing. Okay. The reading should be 0 prior to use, and during the procedure we should maintain the hygiene. And what are the steps of weighing a small baby with the mother or caregiver? We should use an adult weighing scale. The scale here also, the scale should be on a flat, even hard surface. We should ask the mother or caregiver to take the baby in her lap and stand in the middle of the scale, that is designated at W2, and now we should weight the mother alone, that is W1, and it is calculated by subtracting the W2 from W1. And this chart shows you how the baby gains its weight, the rate of growth. Okay, just see the slides. 10 days to 3 months. Now I will ask you a question, why it is written from 10 days, why not from day 1? Can you tell the answer? Anybody can tell the answer? Why it is written from day 10, not from day 1? The answer is, during the first few days of the life, most of the newborn, their losses, they are weighed by approximately 7 to 10% due to extracellular loss of fluid, and this losses is again regained by approximately day 10. That's why it is written from the day 10. So you have to remember this, and the next slide is more important. If the birth weight is X, when the baby gets its birth weight doubled by the age of 5 months, when it gets triple by the age of 1 year. So you have to remember these figures. It is given in most of the textbook. So remember at least when the baby gets double, when the baby gets triple, because you will get lot of question like MCQ from these slides. Expected weight formula is, which formula? You all know this. From 3 months to 12 years, expected weight is age in months plus 9 by 2, 1 to 6 years, it is 2 into age in years plus 8, and from 7 to 12 years, it is 7 into age in year minus 5 divided by 2. Okay. So these values should be plotted. What I was telling, that this value should be plotted on a standardized growth curve. We will have a separate class or demonstration class or growth curve, so I am not going into detail of this growth curve. Just want to tell you that there are so many growth curves are used. There are two types of color. First one is pink color and another one is blue color. Pink is for girls and blue is for boys. Okay, x-axis is for age and y-axis, here y-axis denotes weight. So there are so many lines. These lines are represent the percentile lines. Lowermost is 3rd percentile and uppermost is 97th percentile. If the child's weight falls below 3rd percentile or above 97th percentile, it denotes some pathological condition, the abnormality. Length or height. Length should be measured for children less than 2 years of age by an infantometer, and height should be measured above 2 years by a stadiometer. Okay. How the length or height should be taken? The child should lie on his back on a clean length board, and the head should be in firm contact with the headboard. Child should look straight upwards. The knees should be gently straightened. Footwear should move to the foot, and we should take the measurement in this position, like in this picture. Okay. And how the measurement height should be measured? First, we should remove all the footwear and hairpin, and the child should straight stand on the weighing scale. His back of the heel back of the buttock, back of the shoulders and back of the head should touch the scale, and headboard he should look straight, that is known as the Frankfurt plane, that is the line joining the root of the external auditory meatus to the lower margin of the lower margin of the orbit. Okay, and this headboard should be then gently pulled down, and we should take the measurement in this position. This is the rate of growth, rate of gaining weight from 0 to 12 years. You can easily see that as the baby is growing, the rate of increase height is gradually declining. Okay, as I have told you in the slides. This chart is most important, that at birth the average length is 50 centimeter. The baby is getting his height doubled by the age of 2 years. Okay, at the end of 1 year, he is gaining his height 50% from the birth length. Okay, so it is at the end of 12 months the length is 75 centimeter. At the end of 4 years it is at the end of 4 years it is 100 centimeter. So when the baby gets double of his birth weight কখন double হয়? When the baby gets his birth weight double. When the baby gets his birth weight double, birth weight 5th month, and when the baby gets his height or length gets double, এইমাত্র বললাম, হ্যাঁ, at birth length কত 50 centimeter, after the end of one year 75, and at the end of 4 years it's almost 100 centimeter. That is, so the baby gets his length or height gets doubled by the end of 4 years. Okay, and after after 4 years you can use this formula, that is age in years into 6 plus 77. Okay, so this is the summary of growth, weight and length. You can get this chart from every standard textbook. Please keep in your mind all the formula. Then the head circumference, the hair ornament should be removed. We should use a non-stretchable tape, and we should measure from supraorbital ridge on the forehead to the most prominent part of the occiput, and we should overlap the tape as shown in the picture. These are the value how the head circumference is going, and the standard measurement of head circumference is wise. The head circumference should also be plotted on the standard growth curve. Chest circumference, we should measure the chest circumference at the level of the nipples between midway between the inspiration and expiration. Conventionally, when the child is below 5 years, it is measured in lying down position, and when it is more than 5 years, it is measured in standing position. At birth, the chest circumference is 3 centimeter less than the head circumference. At 1 year, chest circumference is equals to head circumference, and after 1 year, chest circumference is more than the head circumference. This is how the less than 5-year children chest circumference is being measured at lying down position. Then the mid-arm circumference, it is an age independent anthropometric index. Why age independent? Because after 1 year and before 5 years, the subcutaneous tissue and the fats are constantly being replaced by the muscles. So the final circumference remains the same. Okay, it is measured on the left arm midway between the acromion and the olecranon process, with the arm hanging by the side of the body, while ensuring the tape doesn't cause any undue compression of the soft tissue. Okay, in children between the age 6 months to 59 months, that is before 5 years, more than 13.5 centimeter value is considered normal. 12.5 to 13.5 is risk of acute malnutrition. 11.5 to 12.5 is known as moderate acute malnutrition, and less than 11.5 is known as severe acute malnutrition. This is a picture of UNICEF's child mid upper arm circumference tape. The name has been changed. Previously it was called Sakit's tape. It is used in the community and in the hospital setting, because no need to remember the figures. They have to only tie the tape around the midarm, and which the degree of malnutrition is assessed from the color. Okay, if it is green color, then no acute malnutrition. It is yellow that denotes Moderate acute malnutrition or MAM. If it is red, then it is severe acute malnutrition or SAM. The use of Bengal test. Bengal test, it is a ring whose internal diameter was 4 centimeter. That was put into the hand, and if it crosses the elbow, that denotes the child is suffering from malnutrition. But this test is no longer recommended. Next important parameter is body mass index. You have to remember the formula. Please remember it. What is body mass index? It is weight in kg divided by height in meter square. And this figure should be, this value should be plotted on a standard BMI curve. If value is less than 5th centile, it is underweight. 85th to 94th percentile means overweight, and more than 95th percentile indicates obesity. Body proportion. So, two important parameters are upper segment, lower segment ratio and arm span. What is upper segment? Length from the vertex up to the upper border of the symphysis pubis is upper segment, and from the upper border of the symphysis pubis to heel is known as lower segment. How can we calculate this? Upper segment should be calculated easily by subtracting the lower segment from the height. Alternatively, upper segment can be calculated from the sitting height. The child is allowed to sit on a tool, and the head pad should be coming down just like we measure the height. Okay, and if we should take the measurement from here till heel, and if we subtract the tool height from the total height, from this height, we can get the sitting height, the height between these two arrows. So this sitting height is equals to upper segment. Upper segment is equal to sitting height, and by subtracting the upper segment from the total height, we can get the lower segment. Okay. And normal upper segment lower segment ratio at different ages is: at birth 1.7:1, 3 years 1.3:1, at 6 years it is 1.1:1, and at 10 years it is equal. So remember this. At 10 years of life, the upper segment and lower segment ratio becomes equal, that is 1:1. Increased upper segment lower segment ratio is seen in the following pathological condition, that is rickets, achondroplasia, untreated congenital hyperthyroidism. Decreased upper segment lower segment is seen in spondyloepiphyseal dysplasia and vertebral anomalies. Another important parameter for body proportion is arm span. How it is calculated? The child is asked to spread his arms parallel to the ground, and the measurement is taken in between the tip of the two middle finger. Okay, just like this picture, you can see the boy has spread his arms, two sides of the body parallel to the ground, and the measurement taken from here to here, from tip of the middle finger to another tip of the middle finger. When the child is below 5 years, arm span is 1 to 2 centimeter less than the length or height. At age 10 to 12 years, arm span is equals to height. After 12 years, arm span is greater than the height, but the difference is, remember, but the difference is less than 3 centimeter. When the difference is, arm span is more than 3 centimeter than the height, it is pathological. So what are the pathological condition? One is Marfan syndrome, another is homocystinuria or Klinefelter syndrome. And arm span less than the height is achondroplasia and cretinism. The last but not the least important parameter of growth is skin fold thickness. It is a rough screening method to assess the degree of malnutrition. One important instrument used, that is known as Harpenden caliber. The skin fold should be picked up, as you are seeing this picture. The skin fold should be picked up by the thumb and the index finger, and the caliber is applied to the pinched skin. The most commonly used muscles for testing these are triceps and subcapsular tissue. And skin fold thickness of triceps between age 3 months to 5 years is normally more than 10 millimeter, but a value less than 6 millimeter indicates malnutrition. Remember this, skin fold thickness value less than 6 millimeter is indicative of malnutrition. So this was all of today's discussion. We have 5 to 10 minutes time. If sir permits, I can ask some MCQ questions. দেখি কেমন শুনলে সবাই, খুব ইজি কোশ্চেন, যারা ভালো করে শুনেছে বলতে পারবে, সব কিন্তু আজকেই বলা হয়েছে। হোয়াট ইজ গ্রোথ? আমি বলবো, আমি জিজ্ঞাসা করবো হোয়াট ইজ নো, আমি জিজ্ঞাসা করবো হোয়াট ইজ গ্রোথ? হোয়াট ইজ গ্রোথ? নো নো নট হোয়াট ইজ গ্রোথ? হোয়াট ইজ গ্রোথ? হোয়াট ইজ গ্রোথ? হোয়াট ইজ গ্রোথ? What is growth? Hypertrophy. Very good. Right answer, hypertrophy. Fetus is defined as, you stand up. Fetus is defined as, what is fetus? What is fetus? 0 to 14 days is known as, then 14 days to 8 weeks, embryo. 8 weeks to 9 weeks to birth, fetus, and last one birth to newborn. Right, very good. Sit down. All of the following genetic disorder causes short stature except you. So fetal growth is influenced by the fetal, placental and maternal factor. It is true. IGR has significant impact on the postnatal growth. It is also true. And children from families with higher socioeconomic classes usually have a better nutritional state. It is also true. Thus C is false. Growth spurt occur earlier in case of girls, later in case of boys. Upper segment, lower segment ratio at birth is, follow, 1.7:1. Very good. Harpenden caliber is used to measure
skin fold thickness.
Very good. Thank you.